The mechanism of action of the FlexiTouch is simulating lymphatic drainage massage. So the principle of a very gentle skin stretch to stimulate the superficial lymphatics, which are only 2 millimeters below the surface of the skin. We want to stimulate the superficial lymphatics, which are connected to the deep lymphatics, to increase the propulsion rate of fluid. And so specific to the FlexiTouch, we're trying to create that stimulation, and it's been proven to be effective through, of course, near-infrared imaging studies and lots of clinical research, so that the patient can then be consistent and deliver it at home every single time. So of course, we teach our patients self-MLD, and we want them to be confident and equipped to use their hands. But the reality of a chronic and progressive disease is that we can set them up for success when it's programmable, it's consistent every single time, and it's comprehensive.
The information provided on this podcast for educational purposes only and is no intent, nor should be used as a substitute for medical advice. Consult a licensed qualified medical physician for any issues concerning your health. If you would like to know different strategies to improve your quality of life during your cancer journey, this is the podcast for you. Welcome to Taking Charge of My Cancer podcast, where I'll be interviewing different healthcare professionals, cancer survivors, and I'll be teaching you different resources, tips, and solutions so you can get the best outcomes while dealing with a cancer. So welcome back to the latest episode of Taking Charge of My Cancer podcast. And the guest today is Helen Lakts. I hope I'm saying it right. She is an occupational therapist, a certified lymphedema therapist with 12 years of clinical experience, specializing in oncology rehabilitation. Through her career, she has developed and implemented evidence-based treatment protocols to elevate care for patients with head and neck, breast, and gynecological cancers. She currently serves as an Oncology Key Accounts Manager with Tactile Medical, where she partners with clinicians across the country as an educator and a strategic resource. Her role, she delivers advanced cancer rehab education, support protocol development, and connects healthcare teams with tools that improve patient care outcomes. Her work bridges clinical expertise and strategy account development to expand access to high-quality oncology rehabilitation services. We are really excited to have her here to share her expertise and perspective. So let's dive in. So Helen, thank you so much for being with me today.
Thank you for having me. I'm excited to be here.
Great. So what initially drew you into oncology rehabilitation and lymphedema management?
Such a good question. So it was back in 2014, I was a new occupational therapist, and the reality is that they needed a certified lymphedema therapist at the facility I was working in. So I jumped at the chance. I just loved the idea of getting that extra certification and learning more, just diving deeper. And then specific to oncology rehab, it was certainly a need in the community. Didn't have a ton of, protocols stand up, and really patients that were missing out on the opportunity. So that was really where I leaned in and just fell in love with it.
Oh, wow. That's awesome. So you really start doing this as a new grad.
Yeah.
Oh, wow. So that's kind of what you know to do in your professional
My whole world. It's true.
That's awesome. What are the most common misconceptions about lymphedema in cancer patients that you think people has?
I like to say, when you say the word lymphedema, what comes to mind? Just to think breast cancer lymphedema, it's always swelling and it's always arm or leg, swelling of the limb. And the reality right now in 2026 is we see far less swelling of the limb, thank goodness. A lot more preventative surgeries, or just more considerate surgeries that conserve the lymphatics. However, of course, lymphedema is still quite common, and we still see a lot of symptoms in the chest or the breast with breast cancer, or the head and neck for head and neck cancer. So it's really important to look for symptoms and not just swelling, and to inspect the area that is actually being treated surgically or with radiation versus distal from the site of injury.
And that's a very good point. And I'm totally agree with you. Been in this kind of cancer world for about 17 years. And I think it's nice for us not to see this stage 3. I don't think I have seen one of those in a while.
Thank goodness.
Exactly. Exactly. Unfortunately, I mean, we still see them occasionally, but locally, not really. I mean, we are getting smarter and smarter in regarding for surgeons how much really, how much less can we take out, having the same outcomes versus we used to take everything out. So again, more and more concerns about lymphedema is happening upon like in surgery and radiation oncology, where they try to really dissipate that more and more if it's possible, right? If they're able to manage the cancer and be able to do less damage into the lymphatics, then they will. So this is really a great thing. And with surgery and everything that's happening now at the time of surgery has been great things. But I think you're right. We for me, even when I went in to do my CLT, I don't know how was your training, but we were pretty much told, like, just the limb. The limb was totally disconnected for the rest of the body, like, was not really too much trunk, was not really looking at the whole picture, was really barely a little bit on head and neck, if I remember correctly back then. And I don't think has been changing much. Hopefully will, but I don't think
Mhm.
that really has been changing, seeing how much changes is happening with lymphedema and how it's just a part of it and we have to treat it all together.
Mhm.
It's super important.
Agreed. Yeah, I think training's still maybe a little bit behind on the advancements and now seeing more chest and truncal or even abdominal. And you even Google it, you Google the word lymphedema and you always see limbs. It's all limbs. I'm like, oh, we're
Yeah,
totally missing the main point of cancer, certainly cancer related.
correct. How did your transition from clinical practice to a strategy role happen? Like how at one point you were a clinician and you decide, you know what, I'm gonna go into this more kind of working with cells and working with just really pushing into, tactile medical.
Yeah, it's a great question. So my mom was an OT and my dad worked in business. So of course I had to merge the two. So after 5 years in the clinic, I did a lot of outpatient therapy, but I always kind of had that itch and that interest in the business side. So I did get my MBA and did like a 2 year program that was affiliated with my hospital system. And I actually moved to Manhattan and lived in New York for a year and worked as an OT. So I actually got my position with Tactile by moving back to St. Louis and I had a great relationship and just knew kind of the industry and the people there. So I kind of fell into it. Like I didn't really plan it out or think like, ooh, this is what I'm gonna do. But I love and am so passionate about education for lymphedema. And then I certainly wanted to be able to kind of expand my reach and figure out like how I could really make a bigger impact. So that's where the worlds collided. And that was 7 years ago. So I think I made the right choice and it feels like a good fit for me.
Awesome. That's so great to see. Sometimes I see totally why it was an issue for you because it was on your family, it was your dad being in the business. Because sometimes I really feel like it wasn't on your family or you don't have any family member who is on that. I don't think our training in PT or OT really in a school touch much on the business part of things. Like, I always say I'm not really that great on selling. Like I'm really good about selling physical therapy and all what I know on my knowledge, but not necessarily the business part of it, right? So it's always very like, oh my God, how do I do that? How do I really approach somebody? How I really make a deal with, money and all those things. So I think it's we don't get to see that as often in our profession.
It's like totally opposite sometimes. But yeah, so when you get to kind of use both, it's an interesting combination, but it's fun. It's enjoyable.
That's
Mhm.
excellent. For clinicians who may not be familiar, what are pneumatic compression pumps and how do they work and how they are different from regular compression therapy? I know it's a loaded question.
Yeah, it's a good one. So pneumatic compression, maybe even like really specifically, I'm going to talk advanced pneumatic compression, and Tactile Medical has the Flexi Touch. So the mechanism of action of the Flexi Touch is simulating lymphatic drainage massage. So the principle of a very gentle skin stretch to stimulate the superficial lymphatics, which are only 2 millimeters below the surface of the skin. We want to stimulate the superficial lymphatics, which are connected to the deep lymphatics, to increase the propulsion rate of fluid. And so, specific to the Flexi Touch, we're trying to create that stimulation, and it's been proven to be effective through, of course, near infrared imaging studies and lots of clinical research, so that the patient can then be consistent and deliver it at home every single time. So of course we teach our patients self-MLD and we want them to be confident and equipped to use their hands. But the reality of a chronic and progressive disease is that we can set them up for success when it's programmable, it's consistent every single time, and it's comprehensive. So that pneumatic compression device that's covering that affected area, and it's including the proximal treatment, which is so important, draining the proximal lymphatics in the abdomen, the inguinals, the axilla, wherever the patient has the impacted system, giving that very comprehensive massage, and so that they can do that consistently, whether it's multiple times a week or even every day, depending on their symptoms. So then the dynamic nature of the lymphatic drainage massage from the pneumatic compression device is completely different than a static compression garment. So of course, the static garment relies on our muscles to expand and contract, to propel fluid, usually the most effective, of course, on a limb, whereas the dynamic compression lymphatic drainage massage from the garment and from the pneumatic compression, hopefully it's pushing the fluid out of the way, and then we use the static compression to keep it there. So it's a combination of the two. Can't really want to do one without the other, but certainly in areas that don't have muscle pump. So think about the breast. If we have a patient with breast lymphedema, then there is no muscle pumping. So we are completely dependent on the dynamic massage of pneumatic compression or self-massage. But again, patients' limitations in physically being able to reach all the right areas. So did I miss any part of the question?
No, how about, those compression devices that you sometimes you see on the internet or Instagram, like you just for circulation that you just sit and
Yep.
you just connect it. What would be
Yep.
the difference between those two? I kind of get that question often from patients.
That's a good question. You go on Amazon, right? You could order a pump or, make a selection. There's all different kinds of stuff on the market. So the reality is, number one is the mechanism of action. And
Mhm.
so and you even think about like a blood pressure cuff, which is pumping, right? Squeezing and holding. So if there's a high pressure squeeze and hold, and is it programmable? So we have some options on the market that have maybe 4 chambers that squeeze from distal to proximal and push up, and it may even be a high pressure squeeze. That is very different from manual lymphatic drainage massage that we administer as therapists. And so there's some risk of even damaging the lymphatics if you exert high pressure and you're pushing fluid into an already congested pathway. So if you're not decongesting the proximal lymphatics, you're pushing the fluid into a congested pathway and you're using high pressure. You may look like a skinny little ankle after the treatment. However, is it actually, it's not draining or moving the proteins, which is the most important part of lymphatic drainage massage, is moving the proteins in the lymphatic fluid, which needs to be done in it's a slower, more gentle, and it's just the surface of the skin to stimulate the superficial lymphatics versus that tight squeeze and that deeper lymphatic stimulation. So there's of course a lot of variety because some patients have fibrosis and you may need to exert more pressure, in which case higher pressure of course makes sense, but still that proximal drainage and then more chambers in order to drain proximally first before draining distally. So that's kind of a loaded
Yeah.
answer for a simple
Oh,
question, but there's a lot of variety and there's a lot of research. So just to make sure that it's actually like clinically relevant and it's clinically proven to benefit the patient versus even a potential of harming the lymphatic system.
yeah, I like that. What are your thoughts about sometimes, what conditions are these pumps primarily designed to treat, like an advanced lymphedema pump, like, lymphedema, lipedema, venous insufficiency? Like if you have a new clinician, let's pretend that was you 12 years ago, going into clinic and boom, you see your first patient with lymphedema. And then it's like, oh, wait a minute, I just heard about this pump in a commercial. Like, how will you explain that to clinicians? Like, at what point we should be treating or adding a pump into treatments?
That's a really good question. So first and foremost, I look for symptoms. So we certainly don't need to treat an asymptomatic patient. So there's patients that are high risk with a cancer diagnosis, but if they're not symptomatic, then they probably do not need that additional pneumatic compression device. So symptoms, but symptoms should also include symptoms that aren't necessarily swelling. So that's where I think we always see some confusion because sometimes we wait for overt swelling before we would prescribe pneumatic compression and like guilty. Been guilty of that even early in my career, where you kind of like hold off and you say, oh, they're not bad enough, or oh, they can self-manage. But that is the beauty of equipping the patient with a tool to help self-manage and to prevent the disease from progressing. So I love looking for symptoms. I want to know that the patient certainly responds to lymphatic drainage massage. So if you are doing MLD in the clinic, and that patient's responding well, which, is quite often they feel better, they feel lighter, they have alleviation of their symptoms, it's an excellent candidate. And then I think the third part is like, it's my job to just educate them on their options. It's not my job to make the decision for them. And so I'm probably going to let them know, hey, here's a tool. I want you to do a demonstration so you can try it out and then just leave it up to the patient because it's not for everybody. Some may just say, no, thanks. I'm good. I want to do it myself. And that's totally their right to make the decision. But I'm hopefully going to just connect them with the right resources and information so that they feel empowered to make that decision themselves.
How about if we look more into the pump? Like, what is the difference on settings when you're looking at somebody with lymphedema, lipedema, and venous insufficiency?
As far as the symptoms, so first and foremost with lymphedema, then usually we, of course, symptom-wise, heaviness, tightness, impaired range of motion. Of course, I'm thinking like cancer related versus non-cancer. So maybe we'll say cancer related. We have all these signs and symptoms, and of course, their risk factors. So a little more clean cut because we know that they had a surgery and they had perhaps radiation. So we know they're a high risk and then they have some early symptoms. Then with chronic venous insufficiency, usually if we're inspecting and doing a thorough assessment of the lower extremities, then we may see, like I think about the SEEP scale. And so I think about, is there any like venous insufficiency where you actually see like some discoloration? Is there maybe like some varicose veins? Do they have complaints of that like heaviness, tightness, fibrosis, firmness in the legs? So all of those things, again, each one of these have, okay, it's mild, it's stage 1, or oh wow, it's stage 2, it's overt, very clear. I am of the mindset of I'd love to make sure I treat and educate and state earlier, stage 1, and so that we don't wait until it progresses just because we know it's a chronic and progressive disease. And then with lipedema, that is definitely again, it's diagnosis wise, in order to get coverage for pneumatic compression, you have to have that lymphedema diagnosis code. And so if I can justify even a stage 0, stage 1, knowing that the lymphatic system is impaired, they already have symptoms, heaviness, fullness, discomfort, pain, all those things that are happening before perhaps the overt swelling, then I want to educate that patient for sure. But knowing that they do need that diagnosis code in order to qualify for insurance coverage.
How about like settings on the pump itself?
Sorry, I misunderstood. Gosh, that is so case by case dependent. And so every patient who I'm really going to consider what's their tolerance,
Okay.
Where are their symptoms, what's their tolerance, and are they responding? Maybe we start out with a normal pressure and see how they respond. If they're sensitive and we need to decrease the pressure, then we can certainly do that. Or if they are fibrotic and firm, we may need to increase the pressure. So I typically start out at like a normal, which is vastly different for a petite patient with a low BMI versus, an obese patient with a very high BMI. So again, that scale of differentiation is pretty significant. And then there's also all these supplemental programs. And so if I have a patient who maybe they have breast cancer and they have a really tough spot right here in the axilla, so I'm probably going to make sure we have targeted treatment right there in the breast or the axilla. We may do like 20 minutes more just in that spot. Or maybe if they have a lobule in the thigh, like we're going to do 20 minutes more of a supplemental program just in that spot, maybe even increase the pressure. Or if I have a super sensitive, we're going to decrease, so it's just so variable. That's where the demonstration and getting all the options is so important so that they can usually the patient should be a part of it too. Like they should say, this feels good, I like this, or nope, too strong, can't tolerate it, I won't do it. And they can weigh in.
That's great. I didn't realize that you guys were able to do our target area through the pump. I thought it was the same pressure throughout. the whole thing, no matter what?
Supplemental programs, you can also turn off chambers. So we have, of course, if we treat like a wound care patient or perhaps like post-surgical, or if they have like even an expander in, you can turn off the chambers in that area. You can actually go from 25% pressure, 75% pressure, 25, 50, or 75. So you can actually have a lot of ability to adjust. It's very customizable.
Okay. And usually you guys are the ones, so whoever is the person who come and demo
The
and
fitter.
the fitter that just take over all that with the patient.
Yep.
Can the patient change settings in there? Will you guys guide us, or usually how that works?
Yeah, usually it's by prescription. So usually when it's first set up, then it's going to be on the prescription. So there's of course changes that occur, throughout their use of the device, 5, 10 years sometimes, where they'll have this the same device that they're using. And so if they need adjustments, we actually have a clinical team of certified lymphedema therapists internally that can work through it with them. So like what's the challenge, or what they're not getting the response or the treatment that they need, so they can help them reset their settings or add a supplemental program to achieve the outcomes that they're looking for.
Okay, great. That's really good. And I know the next question we already answered, talking about like when should we consider an adding a pump in the plan of care? And then you mentioned the earlier the better, and not necessarily waiting. And I think that's something I did for a while. For a while, I didn't do until nothing else worked. So I'm like, no, patient is doing great. They doing your self MLD. They doing great with their garments. They doing really well. You don't really need that. And then it's like, if something didn't go right or I didn't see any changes, that's when I was thinking about you guys as a last resource of like, no, that's the last thing I want the patient to have. And I think part of it is because we didn't really have a lot of coverage on the pumps. So a lot of
Mhm.
patients knew they didn't have the money to buy it.
Right.
Locally, with the changes on Medicare that is happening, I don't think Medicaid is still covering, right? Not too sure, but and maybe some of them, depending on the Medicaid type of thing.
So we here in Missouri with Medicaid, we don't have coverage, so we pursue patient assistance. So we can do financial assistance, but agree with you. It's like we've for so long, and there's always this like kind of scary insurance topic of like, oh gosh, is it going to cover? Or what's going to happen? So I've over the course of my career, I've been like really trying to separate that insurance factor in education. So if
Okay.
we can educate without considering or making the decision based on that insurance, and just say, hey, I'm going to educate because I think it's that best thing for you. The reality is insurance has gotten a lot better, which
Yeah.
is interesting because of course there's other things that has gotten
Yeah.
worse. And so I'm like, okay, so we've actually gotten a lot better from Medicare Advantage plans, even commercial coverage for like breast and truncal, which is refreshing. And the reality is it's because of the demand. So when we have therapists that demand and order, and they're saying, my patient needs this, and here's some really strong records of why, insurance is listening. And so it's actually really opened up coverage and improved. And that's like even just educating the payer using the Lymphedema Treatment Act, coverage of garments, which is a whole other animal. But it's like we are educating the payer by actually asking for them to cover this, and it has had an impact and created more positive approval. So it's something that I think all of us are responsible for, and it's actually really had a positive impact on patient outcomes.
So, if I have this, because we don't know, so we have a great program where we do a prospective surveillance program. So we get to see patients who are, if they start develop lymphedema, hopefully we reverse them back to the point that we can get them back to zero.
Yeah.
And that's the whole goal of it when we catch it so early. But you don't know if you're going to be able to get them back or not. So let's pretend, you have your surveillance patients who you're seeing 6 months, post-surgery for surveillance, and you do everything, and then some of the numbers start looking up higher. And I will go, okay, let's start with a sleep for a few weeks, and we make sure that you do MLD and everything that you need to do to see if we can get it back down under control. That's where I get a little bit like, when do I start thinking about a pump? You just kind of, should I just wait? Let's do a couple of visits, maybe 2, 3 weeks, see how you're doing. If you back to down where you need to be at, great. We don't need to worry about that. Or, at week 4, we should start jumping the gun and start looking into a possibility of a pump in that situation. How do you manage that?
Yeah, and this is where it's been just the biggest like paradigm shift, right? Again, we used to think swelling, okay, then we order a pump or arm swelling, and now the symptoms look so different. And so that there definitely has to be symptoms. So that's my first and foremost. If they're asymptomatic, they don't need a pump. If they're symptomatic, where they have tightness, firmness, I always really pay attention to the surgical site. So feeling the scar tissue and then feeling the texture of the skin that was radiated. So if that skin is fibrotic, which honestly a lot of times it is, it feels firm, and a lot of times that breast is smaller and the patient is has some discomfort from it,
Okay.
right? So it feels firm. It maybe they even have like some limited range of motion. That skin just doesn't move like it used to. A lot of times that becomes their new normal and they don't complain about it. They're kind of like, oh, I'm okay, I'm fine, everything's fine. But the reality is that's there forever,
Mhm.
right? And now they have to manage that forever. And so I've really come to the point of like, hey, let me just get you this demonstration. I want you to feel what this can feel like and feel what good looks like. And then you decide, is this something that you would even use? Because if you're not going to use it, let's not go there. But if you're like, ooh, this feels good, I think this actually would help me. I can achieve kind of an advanced quality of life by managing this and preventing it from worsening. So those are the kind of the things I'm looking for. Again, definitely symptoms, but not swelling and not waiting for anything to kind of like spread or get worse. So it usually is pretty early on when the patient's having some of those symptoms like post-radiation, post-surgery, where I think we could really do a nice job of kind of like nipping it in the bud and get insurance coverage for it. Because again, this is a patient who's had, breast cancer diagnosis, has symptoms, key terms, the whole 9 yards, where we actually get like Medicare and Medicare Advantage plan coverage. So it's definitely like a very careful, premeditated, like we don't want to get them all excited and then say, oh, sorry, you can't get it. So, so I'm like, I want to be confident that we can actually get this patient what they need. And we've had some really positive insurance wins with this breast and truncal population.
Okay, great. But then you will do it early
Mhm.
on. You will do it as well at that third, fourth week. You don't necessarily
Yeah.
wait. I got you.
To
Okay.
educate the patient, make sure that they can be the one to just kind of decide, am I going to use this for sure? Yeah.
Okay. So when you integrate the pump into therapy, how do you actually do that along with the lymphatic drain and as well the compression garments? Like, what is your order of things that you tell patients?
Yeah, so usually the initial visit is all kinds of information. Maybe they're a little overwhelmed. They're getting the whole 9 yards and we're doing the full assessment. So probably first visit, we're just going to focus on education. I may just, drop the nugget of like, hey, we're going to get, a referral started just so that we can check your benefits. Then within those like first 3 visits, then I'll get a little bit more specific and say, hey, in the clinic, we're going to work on lymphatic drainage massage. We're going to do some scar tissue mobilizations, work on your myofascial release and kind of give them a little preview of what we're going to work on together in clinic. And it's all, of course, very hands-on, customized. And then I tell them, I would like for you to be doing this lymphatic drainage massage at home so that your system is staying healthy. You can, of course, use your hands. I'll teach you manual lymphatic drainage massage. And then I'd like for you to get you started on pneumatic compression. If you're, a good candidate and you like the demonstration, then we can get that started for home. So that should be as soon as we can get coverage and get it worked through insurance. That's their home program. And then I'm going to continue to do what I'm doing in the clinic for as long as I can, continue to make progress with the patient. So I don't wait. And it's like from the first visit, let's get the process started because the reality is insurance takes a while. So it may be a month or 2 months before we even get it. And then at that point, we're like probably ready for discharge. And then hopefully they've already gotten it. Sometimes it does. So there's like Aetna, Cigna, where it's like a couple days. I'm like, this is awesome. Because then they're using their pneumatic compression at home and we're able to make better progress because they're consistently draining their symptom or the system. I'm doing the hands-on massage or the myofascial release soft tissue work in clinic and they're feeling great. We've made better progress. And then compression garments are like, you just always kind of, that's part of it. Some patients are really good and compliant and some are like, nope, we're not doing that. So I'm like, let's see what we can make them be compliant with the fit, the design, all the good stuff. There's so many different options in the market. So I'm just going to try to figure out like how it's going to work best with that patient's schedule.
Yeah, and that is so true. Again, can be very overwhelming, mainly when you have to live with a chronic condition that you have to go every day, same
Hmm.
routine, over and on and on. So I totally get it, how tiring that can be. But I tell patients all the time, if 50% is compression, 50% is your lymphatic drainage, no matter how you do that. And I always tell them, like, again, don't take me wrong, I like the pump, but never gonna replace your hands.
Nope, you're right.
Always work into all that deep tissue you mentioned when you have somebody who has a very fibrotic tissue. And if you're just doing some light touch, you're not gonna do anything into that lymph. So you just need to make sure that the therapist teach the audience out there, listen to this. If they don't know what to do, always get somebody who is a lymphedema therapist, kind of show you different techniques, because we can really work into that deep lymphatics with that deep tissue work prior to getting into
Hmm.
superficial manual lymphatic drainage, prior to the pump. So it's kind of has to be these steps to really be very efficient about it. So that's important.
I'm so glad you said that because it's really should be the adjunct and
Mhm.
it's a complement, never a replacement. So I know people look for the easy button sometimes. I'm like, not the quite. You're going to get a better outcome when you combine skilled clinician care with hands-on, it's education, and then really getting it's very specific and customized. Whereas the pump, it's a comprehensive, but it is a more systemic treatment. So they complement and adjunct so well, but never a one a replacement for the other.
Correct, correct. What does the current research say about the effectiveness of pneumatic compression devices?
Yeah, that's a really good question. So, Tactile Medical, I'll speak, of course, to Tactile Medicals. So, we have well over 30 clinical research studies, and it's all different areas of the body. So, of course, chronic venous insufficiency, you've got breast cancer, you've got head and neck cancer. So, really a very, very in-depth pool of research. And of course, when I look at insurance coverage, they look at economic data. So if the insurance payer is considering covering for the device, they want to know that the patient is going to actually, it's going to save them money in the long term, right? So one of the most profound as far as large studies was over 700 patients. And it's looking at if a patient had usual care, so therapy, looking at if the patient had usual care with a basic pump, basic pneumatic compression, and then looking at usual care with a flexi touch. And those, it's a very, very stark, clear difference that the patient with the advanced pneumatic compression had way better outcomes as far as cost savings. And they're looking at like cellulitis infections, hospitalizations, outpatient visits, and then like the total cost of care for the patient. So in that subset where they had a flexi touch after skilled care, the cost savings per patient was like 37% less.
Oh, wow.
So it's substantial, again, because you're having this patient treat in home long term for this chronic and progressive disease. So the research on just really preventing infections, keeping the patient actually like kind of managing this chronic and progressive disease at home, it's very substantial. And I think it's really interesting kind of dig in and be specific to the patient types because patients should know this too. Like they need to be compelled to be using it and they need to say, okay, I'm going to manage my disease or manage my care, but they better know why and feel like there's some real strong clinical evidence of why. So I love to make sure that patients are well aware of the research.
Got you. Are there specific protocols or best practice clinicians should follow? Like sometimes
Um,
I get stuck, like if I have a patient who asks me anything about a pump, it's like, oh, you need to reach out to them and they can give you
A
that.
couple of, yeah, there's a couple guidelines. The first one that comes to mind is the NCCN guidelines, and just specifically states that patients with cancer, of course, it's the National Comprehensive Cancer Network. So patients who have a diagnosis of cancer should be screened for symptoms and treated for their symptoms in a stage 0 or 1 instead of waiting. So we don't want to wait until something becomes a stage 2 or a stage 3 to intervene. And the NCCN guidelines also, as of 2021, now include pneumatic compression. So the patient should be educated on pneumatic compression so that they're self-managing versus waiting on, somebody else to manage their care. So that's kind of like the first cancer side. And then as far as guidelines like APTA, has guidelines and NLN, there's like a position papers. And so all of those have been supportive and just discussing pneumatic compression usage. So I'd say, like I said, I've been, in this space, lymphedema space for over 10 years. There's been a pretty substantial shift toward being more widely accepting of pneumatic compression. Whereas, again, if you were trained or perhaps took a course, we were very apprehensive. Like we really waited and we even just a lot of concern. And so that's really been a big shift in I think, from APTA, from the NCCN and Learn, NLN, all these lymphedema networks, we're saying like, yeah, we got to make sure we equip these patients long term because they cannot manage, without that additional tool at home.
What are the biggest misconceptions clinicians have about compression pumps?
That's a good one. Misconceptions, coverage is probably the first one. Oh, it's not going to get covered. It's expensive. So those are two that, assumptions. So I think it's really important to have good communication, check benefits, make sure that we're good communicators and finding out the real reason or opportunity for coverage. Those are one. Maybe is the patient going to use it? Compliance. That one, as far as the data, so just over the last couple of years, Tactile Medical has a survey software that aggregates all the patient feedback. And it's been really fun to see because it's honestly like an NPS score and a net promoter score is how the patient perceives the company and the device and the treatment, and they score us, and it's like phenomenal. It's like in the 70s, which in healthcare is like world-class healthcare. So for patients to say, I'm going to promote and say this device is impactful enough in my life that I would actually promote the company. So that's really could be specific geography wise, like your specific clinic or your geography. So I'd ask about it, see if your rep has some good data for you because it's fun to see. But overall, again, as far as compliance, there's always outliers. There's always patients who are unhappy or upset for whatever reason. But the grand majority is like very, very much in wanting to have this treatment at home. So trying to think anything else that you've come across as far as hesitations or
No, I think that's the two main ones. To be honest with you, it's just more
yeah.
one, the patient being insurance not paying or being too expensive. Or sometimes has been patient feels that sometimes it's very cumbersome. Like it's just
Yep.
big. It is just hard to do it themselves. Like I think
Yep.
you have new jackets now. And I have heard that a little bit more on patients that they used to like the ones before because now they're more cumbersome to use. Like, I don't feel my shoulder needs anything on the other side. I don't need this pants part of it. So, yeah, I have heard a little
I'm
bit.
so glad you brought that up because I do hear that a lot. And even if you have like a picture, so like if you have the brochure and it has a picture of the device on the front, it looks ridiculous. It looks wild.
Yeah.
Like you look like an astronaut or something. Like you're coming from outer space or you're the Michelin man or whatever it is. So it's very much like jarring to like see garments or to see a picture. You're like, oh my God, like what the heck? And the reality is once you actually physically feel it and because it's thorough is what it is, right? So that's the best way to explain. It's thorough and it's comprehensive, but the reality is it's very effective. So do I want the effectiveness of the treatment that's clinically sound, that's going to get me the outcomes that I want, or do I want the easy button and just do the simplest thing? And sometimes it depends on the patient, is the reality. Sometimes they just need the easiest thing, and I'm like, all respect, I get it. But for the majority, they just don't understand. And they're like, oh, just give me whatever's easiest. But if they actually understood and really like felt the difference, then they're like, oh, I can do this. Like, okay, I can learn how to zip it out. It's a zipper. It's like, okay, put the jacket on. Okay, I feel like I can do this, especially if it's going to get me the outcome that I want. So there's a lot of education to it, and it's definitely not something that you can just glance at and say, oh yeah, I'd love to try on that vest. They're like, no way. They're like, that looks terrible. So you got to kind of like, let's do a demonstration. Let's feel it, see if it's a good fit, and then we'll talk.
Now that you mentioned that, so let's talk about, that's going to be a little, let's see how you take this question, but it's going to be more, it's so many companies out there with pumps.
Yeah.
So you have, and even we have a lot of the reps come, to be honest,
Yeah, good.
free that come in a regular basis to the clinic.
Yeah, that's good.
And so it's like, if you want to put yourself comparing with like, other companies out there, what would you think Tactile Medical kind of stands from other pumps?
Yeah, that's such a good question. And the first response to that is competition is such a good thing. It's great for our patients because it levels all of us up. So everyone's has to bring their very best, and our lymphedema patient population deserves that. So I'm very happy that we have a very like just a positively momentum from the competitive market. It's a great thing. The patient should have options, right? So as far as we're Tactile Medical, that's the last, 10 plus years of my in-depth knowledge of lymphedema. And I'd say where I feel that Tactile Medical stands apart, if I'm talking like treatment options, I'm thinking about, okay, there's breast and truncal, where I want my patient to be able to target the breast and trunk. And the vest allows them to do that without having to treat their arms. I love that. So I want my young, active lifestyle patient to be able to spot treat her breast without having to do a full hour and have her arm covered. So I just want that like kind of freedom and flexibility. So I love that. Of course, the only ones with head and neck,
Yeah.
and really aggressively pursuing improved payer environment and just committed to the advocacy for the head and neck cancer population. So I feel that's a big deal because those
Yeah.
patients need it and deserve it. So that's just a very underserved patient population where Tactile Medical is committed and has really supported those patients. And then as far as like the lower extremity lipedema, like venous insufficiency, obesity related, that's one that we've definitely leveled up as far as nimble. So nimble just being a more compact, lightweight. There was a preference study where there was multiple companies in a comparison study, and the patients consistently chose nimble due to, again, lightweight and effectiveness. So we don't want to compromise the effectiveness because it's easy, because then if you're not getting the result, then you're not going to use it. That's a big deal. And then same thing with the FlexiTouch. Now that there's zippers and there's thinner fabric, there's zippers, there's been so many advancements over the last couple of years. So if you personally haven't tried it on in a couple of years, I would highly recommend just to make sure that you physically feel it, do the whole 9 yards of getting on and off and all the fun stuff. Because there's just a lot that's different, and it's a good thing. It's because our competitors continue to, make changes, and so do we. So I feel like we've the comprehensive portfolio, and the overall journey for the patient is what's really important to Tactile. So it's not just one shipment and then we move on. It's like, how are we supporting this patient in their entire lymphedema journey from the point of diagnosis for the next 20, 30 years plus?
Got you. Got you. Yeah, that's very good. If we go back
Mhm.
into the head and neck, love it. I love it. Still, hopefully one of these days we're gonna try to get bioimpedance to do finally an assessment of head
Yes, I love it.
breast, right? Or breast. This is the two things that drive me nuts. Like, how do I measure this? Because really, it's
Yes,
subjective. We don't have a great tool like we do now in lower extremity or upper extremity for measure that.
so
But
true.
yeah, but one thing though with the head and neck that I noticed, and I do here, I would say 60% breast, 40% head and neck. So we go back into head and neck. One thing is on the device is sometimes are you guys doing something with the face to improve the face part? Because I have a lot of these patients with mandibulectomies, and unfortunately the garment just really is kind of here, and then all this gets swelled up because there's nothing to cover that face kind of area.
Mhm.
Are you guys working anything to implement that?
So it's definitely always very much welcome feedback. So I appreciate you sharing. And certainly there are definitely conversations of advancing the design and how patients feel, and there's a lot of variety. So we've got everywhere from the claustrophobic patient that doesn't want the fabric, and there's every bit thing in between. So feedback is important, and we'll continue to refine and receive patient feedback. What I can say as far as the current design is that it is designed to be systemic. And so when the patient is having the full vest and the headpiece on, just because it doesn't cover an area, hopefully does not mean that the area is not being treated. And so that's something that patients usually do not understand and get very frustrated by. So it's always this like right here or right here where there's not fabric covering, and it drives them nuts. And so I have to remind them this is a systemic treatment of your lymphatic system. So even if the garment's not covering this one area, you're still receiving lymphatic system treatment. And then we get really creative with some use of some of the chip foam pads. So I always put a chip foam pad underneath here. And then if you have a patient with facial swelling, then I would even go so far as, if they need the mask or they need something underneath so that it's covered, and then there's actually lymphatic drainage and maybe some of the chip foam that's allowing the channel of the pathways to help emphasize, improve the treatment. But I have some patients that won't even wear the headpiece because they're claustrophobic and can still receive benefit of the treatment from the vest because of the proximal treatment, proximal lymphatic drainage. Head and neck's tricky. It's a very complex patient population. It's a lot of being very resourceful because it's a lot of, that's the OT in me that's like, okay, we got to get down to how are we going to make this work, because it's you change something for one side of the population and then the other side's like, oh, we don't like that, we hate that, we don't want more coverage, we want less coverage. I'm like, okay, but there's just so much room to make it more programmable and customized. So I think it's a good conversation to have.
Absolutely, because I would love to have, like you say, it has to be start being so customized that you can actually design it to you have whatever mass you need for a spot treatment. That will be
Right.
great, right? So if I have to
Exactly.
do a mandibulectomy that is like face more than anything else, then yes, I understand the systemic treatment, but it's going to be the same results that you'll do with your spot treatment on the breast or the trunk, right?
Right.
Are more
Mhm.
specific to the patient. Hopefully, you get better results. So great. How do you see technology evolving in lymphedema management over the next 5 to 10 years?
We're hitting the stride, especially with the Lymphedema Treatment Act and definitely with Medicare coverage as far as acknowledgement of chest and truncal and head and neck, being able to pursue. So as far as the advancements, I certainly see a more proactive approach in our near future, and that's supported by the NCCN guidelines and a lot of the position papers. So why we would certainly not wait until a patient's disease progresses before we'd intervene and really be supportive of pneumatic compression. So that's a big one. And then I also, Tactile Medical just acquired Lymphatech. So I'm not sure if you're familiar with Lymphatech, but it is a company that does measurements, and it can measure anywhere in the body. So it's the iPad.
The scan.
Yes.
Yes,
So
yes.
you can scan an area of the body and it gives you the measurements without having to measure the patient. So just super excited about that acquisition and the opportunity to dig in. Maybe it's clinical research, maybe it's really partnering with large academic or lymphedema therapy centers across the US and just really digging deeper to support this patient population. So I envision that will be part of it. I don't know any more details, just enough to be dangerous, but so that's exciting. And overall, again, like the competitive landscape is such a good thing. This makes us all be better and kind of levels everybody up. So there's probably going to be new advancements over the next 5 to 10 years that we don't even know exist right now.
Yeah. If we go back into the Lymphatech, I was trying to we sometimes get like a grant. So we have like an auxiliary grant and sometimes we get to get things that cost money and they're very kind to give us money for that. So I've been trying the last 2 years to get one for the clinic. But last time I reached out, they still not having anything for head and neck. Are they now? Because last time I talked to them in a national lymphedema conference, they say they were working on it. But I don't know if they end up getting something for head and neck measurements.
I thought that there was a possibility to measure head and neck, but I would have to connect you because we actually have two separate teams. It's like a separate force. And so I just, like I said, I know just enough to be dangerous. So I can ask all the questions because I always, of course, want to understand breast and truncal measurements.
Yes.
Just that's my passion is really helping serve those patients that usually, just totally get missed. So I know I've asked that question. I know the head and neck too. So yeah, I'm happy to get more information for you.
And do they have that one for the breast now as well?
The opportunity measure, let me get more information just so that make sure that we get the accurate.
Okay, I got you. I got you. Well, that has been wonderful. It has been great information. I'm sure the audience will be enjoying this and really
Good.
be more deep into the lymph pump world. Some of my colleagues as well, like me, that sometimes it's like we were always thinking for like, well, patient is not getting it. Let's just get them a pump. Or patient physically is impaired to do it. Let's just give them a pump versus start looking ahead of the game. So I think that was really helpful. Thank you so much for this.
Good. Yeah, thank you so much for having me. It was a pleasure.
Okay, great. You have a great evening.
You too.
Bye. Thank you so much for listening to the latest episode of Taking Charge of My Cancer podcast. If you have not already, feel free to share this with more people so they can benefit from this information. If you would like to connect with me, see the information on the podcast description. See you later.